Hi, I'm Robin Boyce, and welcome to City Corner. Today we're going to talk about lifting for life and finding out more about the disparities in minority health. Come on back. Hi, I'm Robin Boyce, and welcome to City Corner. We're here in the studios talking with Mr. Joe Miller, who is Executive Director of the Lift for Life Gym. This is a gymnasium that actually takes care of a lot of young people in the St. Louis community, and I find out also in the St. Louis County community as well. But this is a gym that's open to young people to come in and enjoy themselves and get some exercise. And I've heard a lot about it, so I said I had to get this group on and talk more about what you're doing and how you all wound up in North City, in the North Downtown City area around 14th and Cass. Tell us more about it, and thank you so much for coming on.
Thank you for the opportunity to be here with you today. Yeah, Lift for Life Gym has evolved as so much more than the original weightlifting program that we started as in 1988. So we're a 27-year-old nonprofit organization. We're an after-school program that benefits over 450 kids a year.
Wow.
We have 450 youth members. They become a member of our facility and our program, just like we would join a gym. So it's not just the weightlifting and the fitness programs and the team sports. We've evolved to offer over 30 programs.
Really?
Free to at-risk inner-city youth.
Okay, so these are free programs. So this was actually like a membership type gym originally, or tell us a little bit about
the concept. The founder, Marshall Cohen, started a weightlifting program in the basement of Globe Drugs downtown.
Wow.
Way to keep kids off the street and out of harm's way, give them something productive to do, to benefit their mind and their body. Get strong and push yourself to achieve good things in life. As it moved around from space to space, membership grew, a little bit of funding grew. We finally acquired a space about 15 years ago on Cass, and that's the facility we're in currently. And so the programming is so much more than just that weightlifting now. The weightlifting program is phenomenal with national and internationally ranked athletes.
Some of the kids have come out of there as...
We have a current national and international youth champion out of our facility right now.
Wow. And they get a chance to perform and to compete all over the world, or some of the young people who have come out of the gym have done that?
They learn that cornerstone program, that Olympic-style weightlifting, the snatch and the clean and jerk, just like the Olympians. And so if they can compete at that elite level, they benefit from not just our team, Lift for Life Gym, but also becoming an athlete on a Team USA team representing the United States as well.
That's absolutely phenomenal. So this is a gym that actually started out as a weightlifting kind of a place where young people could come and get those muscles, because they like having those muscles. But it's become more than that. Tell us a little bit about how this program has grown and what it's doing.
Sure. In the last 3 years, we've evolved to offer nutrition, education programs, more than just the weightlifting, other fitness programs for both boys and girls, because we serve a large spectrum, ages 8 to 18. So we have CrossFit, yoga, Zumba, the weightlifting, basketball, competitive basketball teams, but we have gardening programs, cooking programs, nutrition education programs, a college prep program, a college summit program, scholarships for seniors. We're starting a Law and Me program. There's so many programs that we're offering free of charge, but it's not just the programming that happens with our instructors and our coaches, our dedicated staff and volunteers, but it's that free transportation that gets them off the street, out of harm's way, brings them to our program and they benefit from, and a free nutritious meal each night too at our gym.
So young people are picked up from their schools or their homes to come to the Live for Life Gym?
And all over the entire city of St. Louis. We have some dedicated transportation specialists. If you reside in the city of St. Louis, that transportation element is provided free of charge.
All over the city, you will come pick up a child to come and enjoy themselves. Is it just an after school or is weekends?
Currently during the school year, we're a 3 to 6:30 after school program, and in the summer our hours are extended and we operate as early as 10 or 11 in the morning all the way until 6 at night.
So you have a summer situation set up for young people as well, and again, still free?
Free of charge.
How are you able to do this?
We're dedicated to fulfilling our mission
do this?
to give at-risk kids a safe environment. Number one, a safe environment. Number two, a program model that they benefit from and can learn to develop healthy relationships, learn to make positive life choices.
Is this done anywhere else in the country?
We want to keep them on the right path. Many folks have inquired about our model. Would like to see that in their own community. What's funny is that a school was started out of our program.
I was going to ask you, is this associated with the Live for Life Academy?
Live for Life Academy was started inside of our Live for Life gym facilities. So the founder saw the need to do so much more to fulfill the educational needs.
So that is a charter school?
So they are the first charter school in the city of St. Louis. And so it started in Live for Life gym and grew out. Now they have over 600 students.
Yes, they do.
We support a number of their students, but anyone in the city of St. Louis, any child between 8 and 18 become a member of our program.
So the academy, is that primarily a high school, or is that a...
They are now a 6th through 12th grade charter school.
Goodness. So they actually grew from year to year and expanding, and heard some great things about the school and some of the youth who have graduated from there as well, and they're doing some really good things. Sure. Now, is this something you do full time?
Of course it is. It's a small staff that serves a large number of kids. We get no city, state government, or we're not a United Way supported agency. So it's hard work. You have to find some passionate other individuals to support your program with funds.
With so many organizations out here depending on the United Way, depending on state funds, depending on city funds, how are you able to do that?
It's lobbying individuals to consider supporting our program and our youth members through fund drives, back to school drive, holiday drive, winter coat drives, various drives to fulfill the needs of our students, our kids, our members, groups that come in and cook meals to serve, nutritious meals to our kids. Sometimes in the summer, that's the only hot, nutritious meal many of our members get.
Now, this is what amazes me about this organization. I look at your board, and I look at folk who are involved, who volunteer, and they're not from that area. They don't live in that area, and a lot of them don't even live in the city of St. Louis, but they're that dedicated enough to come down to the city and do the right thing. What do you think that says about a community and people, and what attracts people to want to even help out with Live for Life Gym?
Sure, I think they realize the need. I think our staff has been adamant in lobbying, support, and stressing the need to do even more over time to support our inner city youth and families. I think that over time we can serve many more kids and families in the city of St. Louis with additional support. Could our program grow as a model in other communities? I think so. I think it would really take a little bit more support from the community at large, but we have a passionate board, a group of staff and volunteers, instructors, coaches, but anyone can support our organization in a variety of ways. I
was going to ask you, do you have any problems with taking city dollars, because there's a fund that's available on a yearly basis that deals with at-risk youth, and it sounds like that's what you do, but could your organization use that kind of money?
Oh, of course.
Okay.
We could use support in so many ways.
So there's no issue with you taking those kinds of dollars?
Not at all.
Now, with reference to United Way, have you not applied, or it's just a process, or what?
It's a process, and over time as we grow and improve, our outcomes and measurements, of course, for our programs, and our program has grown tremendously in the last 3 years.
You've been in operation about 15 years, so...
15 in that facility, but we're a 27-year-old nonprofit
27-year-old nonprofit organization. So at this point, you're now moving into that kind of corporate streamlining and look, I guess.
We'd like to stay community-based.
Okay. But
that's our focus area, but support comes in a variety of ways. Corporations, foundations, individuals, and through, of course, special events and fundraisers.
What do you think some of the young people are actually truly getting out of being involved with Live for Life Gym? What are some of the comments you might hear from the children? Sure,
and it's surprising that over time some of the teens find our facility, our program, a peaceful place for them. They're exposed to so much crime, drugs, gangs, and violence out in their own community. They live it and breathe it every single day. And so to find folks that want to inspire them and help them achieve success beyond our gym, beyond our program, I think they have come to learn what a true gem Live for Life Gym is.
That's great.
Many of our seniors leave us and enroll in college. We had a senior last year that got a full ride scholarship to Jackson State University.
Wow.
So they can achieve great things. We're pushing them through our programs. We're inspiring them. We're engaging them. And you know, most of all, we're there consistently for our youth.
And that's what's totally making the difference. Getting our young people to do the right thing. And how do you then squelch any of the violence or things that come in from the streets there? How are you able to kind of help them understand that this is not the place for it and that this is a peaceful place?
Sure, it's through our character development programs. It's through our new Law on Me program that we're trying to develop. It's through roundtable discussions, peer discussions, teens and teens. I think we listen, number one. We listen to our youth. What do they want to share with us? What programs would they like to see to benefit from here at the gym? And that's, you know, come a long way from what we started with just weightlifting and just throwing them bodybuilding and the strength. But strong minds and strong bodies has been our concept for a long, long time, and we continue to support them.
That's basically the bottom line to any community growing, isn't it? Making sure that those minds are healthy, that young people are healthy, and that's what's really going to make a difference of young people coming out of the Live for Life Gym.
That's right.
They are really feeling like I can win here and I can make a difference here. Are any educators seeing a difference, or some of the schools that some of the young people might go to?
Of course. I mean, we get many referrals from local schools, from hospitals, from Grace Hill Settlement. There's many champion partners that refer kids and families through our program, but we need so many more partners, of course, to ensure success beyond. So you could use some more partnerships of individuals referring young people to the organization that may need help.
That's right. Parents, what are they talking about? What are they saying about the change they may have seen in their daughter, or the change they may see going on in their son or their nephew or niece?
Sure, and it's expressed to us daily. On a daily basis, parents expressing how grateful they are for a program like ours. It's keeping their kids off the street, out of harm's way, but it's also they see their character changing, their demeanor changing.
Really?
They're seeing their grades change. We're helping them focus. We have homework assistants and tutors. I think that parents appreciate all we do to help them.
Where can people call, or where can they go to make donations to Live for Life Gym?
Sure. liveforlifegym.org is our website. There's many ways that you can help. Volunteering your time, volunteering with in-kind donations, financial support, or even referring us to other possible partners of our organization.
Great. I want to thank you.
liveforlifegym.org, yes.
Thank you so much for coming on and talking with us about Live for Life Gym, and we'd like to be a lot more involved with what you're doing down there.
Thanks for the opportunity.
Thank
we hope
you.
to be here for 27 more years.
You will be. Thank you so much. And I want to thank you for joining us for this conversation, but we will be right back in just a moment.
Hi, my name's CJ. A few years ago, my father became seriously ill. I did what I could do before he passed, but it took its toll. I lost my job, my house. I'm getting back on my feet, but I don't know when there'll be food on the table. How'd I do, CJ?
We could be twins.
Well, cousins, maybe.
Play a role in ending hunger. Visit feedingamerica.org/hunger and find your local food bank.
If you drive buzzed, it could cost you around $10,000. You'll face major legal fees, major fines, and steep insurance penalties. You could lose everything. Nothing kills a buzz like getting pulled over for buzz driving, because buzz driving is drunk driving.
And back in the studio, I'm Robin Boyce, and along with me this segment is Mr. Erise Williams Jr., who is CEO and President of Williams and Associates, Inc. This is an organization that for many, many years has been looking at the disparities in healthcare for minorities in the St. Louis community. And I first met Erise many years ago when I was doing a talk show for the then Magic 108 Sunday Morning Live program. And on that program, we talked about blacks assisting blacks with reference to AIDS. And how has that project been going? And it looks like that project has grown into what it is you're doing right now.
Right, we actually have evolved in terms of addressing minority health disparities. Having been on the front lines of addressing HIV and AIDS, it became quite prevalent to us that you couldn't just do it in a vacuum. Because many of the people that we were assisting, actually, some of them were entering the healthcare system for the first time. And then they were also finding out that not only did they have HIV, but they had things like diabetes or sickle cell anemia or something like that. So it was like we have these multitude of health issues that disproportionately impact minority communities for several reasons. And so it became, quite evident to us that we had to really broaden our scope and really look at it.
And when you say broaden your scope, that meant you had to do what exactly?
Well, it meant that we took some of the techniques that we use in the community to address HIV and AIDS to address things like diabetes. And when you have someone, for instance, who's living with HIV and who also has diabetes, so they have two chronic illnesses, how do you manage that? How do you keep check of your numbers, both your viral load and your T-cell count in terms of HIV, and also your glucose levels and your A1C levels.
So it's basically an educational experience, what you all have done over the years in educating the patient about what's going on with them. Now, when it comes to disparities, is this because minorities don't have access to health care or know that they have their health care? What have you found over the years?
That is one of the primary reasons why the disparities exist. But like I said, there are several variables. When we talk about health disparities, let me explain what that means exactly. We're talking about a disproportionate impact. So to give an example, women in breast cancer. Caucasian women are diagnosed with breast cancer more often than African American women. But African American women die from breast cancer.
Okay, why is that? Why do we have that kind of wide disparity?
That kind of disparity. It has to do with access to health care. It has to do with access to preventative health care and this thing that we in public health call social determinants of health. Those are those things that in the long run have an impact on your overall health. So when we talk about people who don't have employment, sometimes employment equals health insurance. So that impacts your health. We talk about housing, poor housing or a lack of housing impacts your health. When we talk about environmental issues,
I was going to say environment.
like violence and what have you, that impacts your overall health. So our job, when I look at it, the task is very large, but we have to start chipping away at it so that we can start to eradicate some of these health disparities.
So over the years, you've been involved with this how long now? It's over almost 30-some years.
You've been,
oh, wow.
I started when I was like 21, 22.
Yeah, I remember that. And having you on the show and we talking about that is when AIDS really started becoming a hot button issue that finally people were saying, hey, something's going on here.
Right, exactly.
With reference to AIDS and what's going on, we've been dealing with that disease for several years now. There's some protocols that are out there that folks are still living and doing quite well.
Yes, they are.
What does St. Louis look like on a scale of 1 to 10, 10 being a good thing that AIDS is down, we're doing better with it? How's the St. Louis area looking?
Well, the St. Louis area pretty much reflects what's happening across the country. When we talk about new infections, unfortunately, we are still seeing new infections among young people, particularly young African American men between the ages of 13 and 24. They account for more than 80% of the new infections, in terms of what's happening in our area and across the country. So now there's this national focus on how do we reach young African American men around prevention. And we're also looking at different techniques to do that, because what worked 30 years ago may not necessarily work today. When we talk about sexually transmitted diseases, as you know, since you've been covering, what's happening in our city, many of the STDs, syphilis, gonorrhea, St. Louis still ranks pretty high.
St. Louis still ranks pretty high with reference to STDs.
Yeah, and particularly gonorrhea and chlamydia.
As much as the education has gone out here, St. Louis City Public Health has really pushed it down, from St. Louis City point and other organizations like yours. What's?
Well, it really has to do with getting people to change behavior. And it's also talking about changing social norms. If I don't think that I'm at risk, if I don't think it's going to impact me, then I'm not going to take any action. We are still trying to market and get the message out that these diseases do not discriminate, even though they impact certain populations, disproportionately. They have an impact on the overall population.
So we're seeing AIDS higher in African American males now, between the ages of 13 to 20-something years old?
Yeah, and then when we talk about women, African American women still account for a disproportionate have a disproportionate impact of HIV and AIDS among women.
Okay. So basically, we still have an acceptance or a change behavior issue here.
Yes, we do. And a lot of that has to do with the fact that, again, this sense of vulnerability. When I talk about young people, they don't think about it. When I talk about young people between the ages of 13 and 24, keep in mind, they were born into the world with HIV and AIDS. They don't remember a time when their HIV did not exist. So this is kind of a normal thing for them, I think it's sort of a catch-22 is the medications and treatments have gotten much, much better.
Okay.
People don't look like they have HIV.
No, they don't.
So it's kind of like, out of sight, out of mind. And if, and from a young person's perspective, if I get it, I can take this medication and I'll be okay. But what they don't realize is there is no cure for HIV. So you will have to have it the rest of your life. And we don't know the long-term impact of this medication. If you're 17 years old and you become infected with HIV, you have to be on that medication for the rest of your life. What is it going to look like when you're 25 or when you're 30 or 40? What are going to be some of the side effects of how?
And you may want to have children.
And you may want to have children.
And there goes a generation of folk who may, become infected through the bloodstream if you're carrying a child or if you can conceive a child. So at this point in the game, it's almost like we have to, and I go back to this all the time, and especially when I was working on the Strive project we talked about before going on the air, that was talking about stopping the violence in the St. Louis area, which is a lot of what's going on right now too. A lot of organizations have come out with reference to stopping the violence. It's almost like we have to get a commercial going like the Surgeon General did back in the day with reference to cigarette smoking. And that strong message made a big difference with reference to people stopping smoking altogether. It has made a huge difference. But that same kind of messaging has to happen with reference to AIDS, STDs.
Right, and all of those health elements that are preventable that unfortunately minority populations are, dying from or finding themselves being heavily impacted by.
Now, is this something that our minority health situations are totally being ignored by the minority community, or they don't care, or what is it?
No, I wouldn't say that. I think what it is it's about resources.
Okay.
Just
having that access again.
Just having that access again, right. Many minority populations across the country, lack the resources to really take on a proactive role in terms of addressing these issues.
So if we had more doctors' offices and say, for example, communiplexes, that some things that we were trying to create a few years back, where you had medical facilities, clinics, places where folks could go, you think we would see a lower rate?
Yeah, I think we would. I think because
in those needed communities.
In those needed communities, right. And it's about preparing the community to take on that proactive role. When we talk about working with our young people, getting them to have an interest in medicine or have an interest in public health, that would make a difference for sure. So,
say for example, there's a new school that started maybe 3 years ago now called the Collegiate Bioscience Medical High School. Those young people, 50% African American, was primarily started to get more black doctors in the medical profession of
And
no
that's
field. So
correct.
you got these really awesome people on this advisory board who are part of BJC, WashU, St. Louis University, some doctors and so forth and so on, and folks in the Cortex that are involved. A young person having that kind of involvement in a high school like that could make a difference?
Could make a difference, right? And it's a long-term kind of difference. But when we talk about eradicating health disparities, that's what we have to look at. We have to look at what can we do in the short term. The short term is about empowering individuals to make individual choices and change around their health care so they have a more positive health outcome. The long term is how do we prepare our community and our community members to address these issues ongoing, because other than that, they won't go away.
So it's consistently getting out there and pounding the pavement like you all been doing for years now.
Yes,
I mean, going to the clubs,
right.
talking to folks, churches, everywhere, and really, and how receptive have churches been to your messaging?
I would say they are more receptive now than they were 30 years ago.
Okay, so what changed, you think? What's happening?
I think it's because of the impact. You know, there's no way you can turn your head, you know, you know, turn a blind eye to it, because it's starting to hit home.
People are getting infected in those congregations, and they're seeing folks.
Yeah, so it's about, well, we have to do something.
So you are seeing a change with reference to the religious community, saying, look, we need to have someone come in and talk about this issue, and or have an individual who's a specialist that might be in the church and part of a ministry. You see more and more of that happening
more
now?
of that, and also testing, because if we really want to try to eradicate, particularly HIV, you know, it's about people knowing their status, because with today's treatment, you know, no one has to die from HIV.
Suppose, okay, I was going to ask you this one, but suppose you are an at-risk kind of a person, you've had an at-risk kind of sexual life for a long time, how often should you be tested? For HIV, STDs,
well, the Center for Disease Control is suggesting that it becomes part of your routine medical care.
Okay, so once a year, when you're doing your annual, when you do your blood test, you should really, and you should ask your doctor.
Ask your doctor, because they won't automatically do it.
They won't, so you ask them to look into blah, blah, blah to see if everything's okay. I want to thank you so much for coming in and talking with us, but you've got to come back, and I want to have some more panelists on with you to really delve into some of the things that we need to do to make a difference in the St. Louis community and solving this issue, because I thought we were doing a bang-up job, and we were getting past some stuff. But we can always do better.
Yes.
Well, thank you so much, Erise, for coming on. It's so good to see you, and I want to thank you so much for joining us here on City Corner. You have an awesome week, and I will see you the next time here on City Corner. I'm Robin Boyce.